Good morning, Baguio. Good morning, Philippines. Welcome to a special episode of Health Matters sa Baguio Chronicle. Today, we're going to talk about mental health, but from another perspective. We have with us a special guest from the Philippine Mental Health Association who serves as the executive manager at the moment for the Baguio Regional Chapter. I used to think that it's just for Baguio. Ang laki pala ng scope ng inyong opisina. So today, let's welcome to our episode Miss Gina Camsol. Ma'am Gina?
Good morning, ma'am. Good morning sa ating mga viewers. So, I'm happy to be here, especially that we just celebrated the National Mental Health Week and we are currently celebrating the National Mental Health Month. So, happy Mental Health Month sa ating lahat.
Ma'am, bago natin simulan yung ating discussion sa mental health in the workplace, can you tell us what PMHA or the Philippine Mental Health Association actually is doing?
Okay, so ang Philippine Mental Health Association, actually we are Cordillera Chapter. We used to be Baguio Benguet Chapter. However, we expanded our jurisdiction, so naging Cordillera Chapter tayo. Ang main office namin is nasa Quezon City and we have other chapters all over the Philippines. We have 7 chapters. Ang nearest po sa atin is yung Dagupan Chapter. Ano ba ang pinakamisyon ni PMHA? Kami po ay naniniwala na sana bawat Pilipino ay matutong alagaan ang kanilang kalusugang pangkaisipan to attain the highest level of sound mental health. Yun yung vision pala ng PMHA. To do this, to be able to realize this, anong ginagawa namin? We have 2 major programs. Una is the Education Advocacy and Research Department. Anong ginagawa namin dito? We are highly on IEC. We do a lot of lectures, we do a lot of seminars because we believe na the best way to prevent the occurrence of mental illness is to encourage people to understand ano nga ba tong mental health. Pareho ba ito sa mental illness? Pag nagpa-check up ba ako sa psychologist o sa psychiatrist, baliw na ba ako? So ito yung mga kinokorek nating concept sa ating komunidad. So we have a lot of trainings and seminars sa stress management, parenting. For the youth, we have youth groups. We train them to become mental health leaders habang bata pa sila. Diba? Kasi dapat habang bata marunong nang mag-cope positively sa stress. So ito yung mga tinuturo natin sa kanila. So, we also go to the community. We have the community-based mental health program. Dito naman po, we train yung mga barangay health workers. Kasi sila ang nasa grassroots, di ba?
Oo.
So,
sila yung first point of contact, kumbaga, sa health
Oo,
services.
tama, ma'am.
Oo.
So, pag nagbibisita yan sa mga bahay-bahay, at least alam nila kung sino na yung kailangan ng mental health services, di ba? Mare-refer nila. Para sana habang maaga pa, yung mga simptomas, pag nakakakitaan na ng simptomas, mas maagang mai-refer, mas mabilis ang management ng case.
Tsaka mas mabilis gumaling, no?
Yes,
oo.
ganon.
So, ano pala, from what we're hearing now, nasa preventive side ang PMHA,
Yung
no?
isa, oo.
Kasi yung sa ating mga medical side, that's the treatment already.
Yes,
So,
yes.
before magkaroon ng sakit, ito yung intervention na ginagawa ni
Yes,
PMHA. So, it's so heartwarming na malaman na may mga ganyang services na nasa community natin mismo, no?
Yes.
Kasi this is especially natataon. It's so
Tama.
relevant during these times because we're hearing a lot of mental health cases.
Yes,
Oo.
yes.
So, I think itong generation na to, ito yung parang very sensitive to a lot of things happening in their environment.
Yeah.
Kaya we're getting a lot of reports on ang pinaka-ultimate dyan, yung suicide. So, there is an increased rate in suicide.
Yes.
Hindi lang sa mga kabataan, even in
working
adult
Yes.
members of our population. Going back, ano nga ba yung reason for the theme being mental health in the workplace? What are the common mental health issues in the workplace?
Unang-una sa lahat, we were very happy when the World Federation on mental health. Sila talaga yung naglabas ng theme. So this is a worldwide theme
Okay.
for the national mental
Hindi lang
health.
pala Pilipinas,
Yeah, hindi
ano?
lang yan
Oo,
Pilipinas.
oo.
So worldwide, they recognize that there is a need to focus also on the workers. Kasi for the past years, it's always been yung mga children, women, and finally, kaming tayong manggagawa, mayroon na ring theme para sa atin. So, worldwide din kasi nakikitaan na nag-i-increase ang mental health issues among the working population. Actually, if you look at the statistics, kung dati-dati noon, yung younger generations ang mataas ang suicide cases. At this time, when we were looking at the statistics, nasa working population na. Itong mga young professionals natin, mga below 30, 20s to 30s, 22 to 30s, yun yung pinakamataas ang cases ng suicide. So, it's just a reflection that this population are also encountering mental health concerns. So, it's just proper that we have to make the theme on the workplace. So, dito po sa Pilipinas, when we went to the National Center for Mental Health just last month, when I was talking to the psychiatrist, dati-dati ang mataas na case natin is depression. However, last year, tumaas ang anxiety. So, according to the doctors, it's because of the pandemic. It's an effect of the pandemic. Kaya nga sabi nila, after the pandemic, we have the second pandemic. This is the mental health pandemic. It's a silent pandemic. So, which it confirms dito sa ating place, marami po yung may depression and anxiety. Kung minsan, ito na yung na-diagnose. However, yung napapansin natin and based sa mga researches, burnout, ang stress normal lang yan sa workplace, di ba?
Kasi you have to beat deadlines, mga ganon,
Yes,
no?
that's a normal part. Pero pag prolong kasi yung stress mo, tapos hindi ka na nakaka-cope o yung mga coping mechanisms mo ay hindi na effective. Tapos yung intensity pataas ng pataas until you reach yung point na pagod ka na, it will go down to burnout. Pag hindi po kasi natin na asikaso tong burnout, hindi natin natugunan, it can lead to depression and anxiety. So, ito yung mga karamihan na cases natin sa workplace. Siguro para lang clear, when we talk about mental health, it's a spectrum.
Okay.
It's a spectrum. Parang dito, you have good mental health, then what we call mental ill health. Ito yung, it's not, you are not 100% mentally healthy, but you do not have the disorder. Then, we have the mental illness. So, pwede kasing, paggising mo kaninang umaga, okay yung mood mo. So, you positive yung mental health mo. So, nandito ka sa further side ng spectrum. However, nung papunta ka dito, na traffic ka, ang init nung inupuan mo, so na-stress ka, yung mental health mo, bumababa siya, nagiging negative.
Okay.
Pero, pag nakarating ka na dito, parang ako, nakarating na ako dito, and we were having this conversation, and I'm enjoying it, bumabalik ulit yung mental health ko sa positive. So, parang ganun, yung mental health condition natin, kasi it varies. Ang problem natin, pag prolong, yung sinasabi ko kanina, na stress ka sa work, tapos hindi ka nakakope, tuloy-tuloy yan, magiging, yung burnout actually is nasa ill health siya. That's what we call, it's ill health siya. Pag hindi yan natugunan, or pag yan grumabe, babagsak yan sa illness. So, yun na yung depression and anxiety. Kaya when we do this advocacy, ang sinasabi natin sa mga tao, know the warning signs. Alamin mo, then you come up with positive coping skills para bumalik ka dito na side ng mental health. So, parang ganun po siya.
That's interesting, oo. Pero, ano nga ba yung mga triggers in the workplace? So, what can lead to a burnout?
Karamihan sa mga nakakausap ko from the workplace, yung communication. May problem sa communication sa loob ng agency. Like there is something wrong with the communication. They cannot speak what they want, or feeling nila hindi sila naririnig. Another one is yung workload. Sometimes, ang dami-daming workload. Usually naman, nagkaka-job stress ka kung yung workload mo is hindi akma sa
Sa
capacity mo
skills mo. Okay.
and sa resources.
Mm.
'Di ba? Parang sasabihin ko, gawa ka ng report, wala namang ibibigay sa akin na computer.
Yeah.
Or
Or yung
mag-aantayan.
information,
Oo.
how will you do the report?
Yes, ang hina ng internet sa office and you need the report by this time, parang ganon. So, ang job stress, sabi ko nga, andyan lang yan. Pero it can become aggravated if yun nga, the resources is not enough and your skill is not at par with the demand of the work.
Okay.
So, yun. Kaya siguro, kasi may mga ibang tao, kahit madaming workload, pag akma yun sa skill niya, kayang-kaya niyang
Oo.
tapusin yan, di ba?
Kaya sa deadline.
Opo. Pero meron din yung mga, konti naman yung dinedemand sa kanya, pero hindi niya natatapos. Kasi nga, hindi siya akma sa kanyang skills.
Hindi niya kaya sa
Yes.
level of competence.
Yes, ma'am.
Oo.
So, kaya yon yung effect ng job stress sa kanya is mas grabe as compared dito sa isang tao na to.
Okay. Oo.
So, yan, the workload, communication pattern, unclear na policies sa isang agency, pag hindi magkakapareho ang interpretation or pag walang policy na hindi alam ng mga staff kung ano ba yung talagang susundin, di ba? So, ayan, ano pa, actually yung sa finances, according to the studies, it's more of yung, it's not how much, but yung, ang mas nakaka-cause ng stress is if you lose the job. It's not really having lower pay. What stresses more is you losing your job. Yun yung mas impactful sa mga personnel.
We were also talking about manifestations. Saan usually age group nagmamanifest? In the study that we were discussing earlier prior to this episode is, ang sinasabi doon, ang pinakamataas ay ang mga millennials at saka mga Generation Z. Mga Gen Z, ano? So, etong mga ages na to, ang Gen Z are in their 20s and the millennials are in their 30s or above, no? Oo. And this is the stage where, for most of them, they're starting work.
Yes,
No?
yes.
So probably from university education, they finally land in a job. So there are so many things happening in their environment that they have to cope up with. Kunyari yung mga fresh graduates into their first jobs.
Yes,
Yeah,
yes.
so hindi lang yung demands ng work,
Hindi lang.
but it's the social context din, di
Yes,
ba?
exactly.
This is adult world na, hindi na
Yes.
ito yung
Ikaw ba naman
ating
yung wala ka ng
estudyante.
allowance?
You have to pay for your way na, hindi
Yes,
na
tama,
tumatanggap sa
tama.
magulang. So, is this one of the defining factors? They're not coping only with yung demands of the work,
Yeah,
but
yeah.
also personal transitions that they're
Yes,
going
yes.
through.
Yes, well, that can be a factor. Pero lagi kong sinasabi, that will depend on the person. Kaya, kasi lahat naman tayo noon, di ba? We started working din naman. Parang ako noon, 20 years old, nag-start na akong nag-work. So, lahat naman tayo, we go through the transition.
Yes, yes.
Ang pinakamahalaga dito is, you have to know your coping mechanisms. Kaya very, very important. How do you really take care of your mental health? Kasi, normal yan, mai-stress ka sa first job mo.
And even in school, may practice ng mga bata ng stress, di ba?
Diba? So, it's more of knowing how do you really cope? How do you, how resilient are you? So, sometimes I pity these younger employees because they were a victim of the pandemic, yung mga modular na schooling. Parang kasi tayo noon, nag-practicum tayo. We really went out
in the
on
real
field.
world.
Yes. Itong mga batang to, nag-practicum sila online. So, syempre, tapos
It doesn't compare.
Yes, tapos isasabak mo siya sa real world na talaga. So, talagang siguro that increases yung, that makes the difference kung bakit sa atin mas madali tayong nakakope noon. It's because we were given more opportunity to experience the real world as compared to them na nandito naman sila sa online world sila nag-practicum. So, like yung iba nga, when I interview some of our employees, ang practicum nila is nag-attend na lang ng webinar. I-compare mo naman ako na nung nag-practicum ako, pumunta ako sa school na nag-conduct ng counseling. So, na real na tao yung kinausap ko. So, I think that makes the difference. That's why they are also mas mataas yung adjustment nila. Yung isa pang nakikita ko pala, ma'am, I forgot to mention, is yung leadership styles. Siyempre, yung mga boss, ngayon, they came from a generation na iba.
Yes, that's
Itong
right.
mga younger workers natin, iba ang work values nila. Mabilis magtrabaho ang mga yan, pero 8 to 5 is 8 to 5.
Yeah.
Tayo
At the
noon,
sound of 5 o'clock, they're
yes,
off.
me time na yan sa kanila.
Oo,
Pero
oo.
sa atin noon, kahit mag-extend ka ng 6 o'clock, service to the Filipino
Yeah,
people
yeah,
yon.
yeah.
Ngayon,
Oo.
credit time off. They will
Oo.
ask it. Pag pina-overtime mo yan hanggang 6, i-credit
Yeah,
time
oo.
off nila
Offset
yon.
ba?
Offset nila
Offsetting.
yon.
Or they
Oo.
get overtime pay?
Yeah, it's
Uh-huh.
offsetting or overtime pay. So for yung mga leaders din naman ngayon, parang ano ba naman itong mga bata to? Parang wala na yung extra mile.
Yeah, parang that's what I'm hearing from
Yeah.
from sabihin na nating mga old-timers in an institution. Ibig
Oo.
sabihin, they are in the position na sila na yung mga boss, no?
Yes,
And then
yes.
that's what I commonly hear.
Here. Totoo po.
Oo, pero from what you're saying din na na dapat sila rin nag-a-adjust pala, understanding where yung context ng
Ng
mga
mga
young workers,
Oo.
oo. Which is, ibang-iba.
Oo, ibigay mo lahat sa kanila, then you monitor them 8 to 5 para
Oo.
siguradong matapos nila yung output within that time.
Yeah, yeah.
Kaya yun. So, I think those are the things that we, as heads also, have to adjust to these younger generations para maiwasan natin yung stress in the
Yeah.
workplace.
So coping, educating people in coping mechanisms
Yeah.
should work both ways, ano?
Yes, ma'am.
The head of the head of the office and
Yes.
the young workers as
Of
well.
course,
Oo,
oo.
oo. But I was just thinking, kasi nga sabi natin, these are very young people. May impact din ba pag, alam mo, there are families kasi na who are overly protective
Yeah,
of their children. Sometimes it backfires.
of course.
I think this is one situation where it backfires because of the overprotection of some parents. The child is denied the opportunity to cope on her own. So siguro, Miss Gina, is that something we should also give advice to sa mga magulang?
Yeah, I know how it is. Pero
Oo.
totoo yun, sometimes
Oo.
we cannot blame parents kasi parang tayo ayaw nating ipa-experience sa mga anak natin yung parang
Dinaanan
dinaanan
natin. Oo,
natin.
ganun
But
ang kulturang Pinoy di ba?
yes,
Which is,
yes.
kung minsan may downside, di
Yes.
ba?
And that is the one of the downside. Kumbaga,
Oo.
hindi na marunong dumiskarte ang mga bata kasi binibigay na kasi natin lahat.
Oo.
Sometimes you have to let them feel a little pain, a
Yeah.
little worry so that they will know how to navigate it.
Tama.
Oo. So,
Kasi nga
yun.
ngayon parang konting hirap lang, give up na, di ba?
Mm.
So again, dapat may healthy balance
Of
of
course.
being protective, which is a normal default of
Parents,
parents,
yes.
and allowing them to grow and feel pain. Kasi
Yes.
sabi nga, di ba, it makes them stronger, ano?
Totoo.
Oo. So,
Parang tayo, di ba? Naging resilient tayo. Di ba
oo,
dahil sa
kasi
mga
you're on your own.
you
I
went to
belong.
apply on your own, nag-interview ka on your own.
Ano pa nga ba ma-identify natin in the workplace that we can actually give recommendations to na sana i-practice in the workplace?
Yeah. Siguro yung isang na-miss out natin kanina is yung merely giving recognition, appreciation,
yeah,
yung
oo.
konting thank you, good job, ang ayos ng pagkagawa mo. I think this builds confidence, this gives positive feelings sa ating mga workers. Ang masasabi ko lang naman, ma'am, I think we are on the right track because the Mental Health Act, which was recently passed, it's the RA 11036. It mandates all offices to come up with mental health program for their employees. So, right now, yun yung isang pinagkakabisihan ni PMHA. We are helping agencies to come up with their mental health policies and protocols. Actually, just yesterday, I was in La Trinidad. We are helping the LGU of La Trinidad come up with the workplace policy. So, nag-IEC kami. And, alam mo yun, na-appreciate na nila ngayon yung mental health. So, oo nga, dapat may ganito rin, may ganito rin. So, we hope that our partner agencies, the LGUs and more offices, will be more open to come up with their own mental health
Yeah.
policies.
And if they are not, that capable to make their own, they can always reach
Yeah.
out to PMHA,
Yes,
right? Oo.
yes. They can reach out to PMHA and to the other mental health practitioners here in Baguio City and Benguet. Kasi we are lucky dito kasi marami kami. Sa lagay na
Oo.
to, marami kami
Oo.
pero marami pa rin kliyente because
Oo.
there are some areas wherein walang mental health practitioners. Like our chapter in Dumaguete, manggagaling pa ng Cebu, yung
Ah,
kanilang psychiatrist.
yeah.
'Di ba?
Oo,
Also, our
oo.
Cebu chapter is helping Bohol, one of the far-flung
Oo.
municipalities of Bohol. Parang ganun. Like for us, wala tayong psychiatrist sa Apayao.
Mm.
Wala tayong psychiatrist sa Kalinga. So,
Mm-mm.
alam mo yun, we are lucky here in Baguio and Benguet that there are practitioners. So, you might as well
Yeah.
avail of these
Yeah, avail of
services.
these services.
Oo.
Oo, ngayong nabanggit nga natin kanina na, well, Baguio has always been known as an education center, no,
Yes,
in the
yes,
north. But
ma'am.
from what I'm hearing now, we are already a regional health center, no?
Yeah.
At saka nababalitaan din natin na marami nga na sa mga kalapit na probinsya or
Probinsya.
even region like Region
Mm-mm.
1 and Region 2. They
Yes,
come up
they come
here
here.
for health services talaga.
Totoo po. Actually,
Oo.
kami nga, our secondary program actually is with the clinical and diagnostic service. We do psychological evaluations.
Okay.
And we
Oo.
have clients as far as Pangasinan, yung mga abused children,
Mm.
mga survivors of abuse. That's why our staff, we are
Mm.
going to attend yung mga hearings as far as
Mm.
Pangasinan. And these are
Even assistance when they want to sue somebody pala.
Yes,
Oo.
marami tayong cases na ganyan.
Oo,
So,
oo.
we hope that in the near future, itong mga nearby places din, they can come up
Oo.
with these kinds of programs to make it more accessible.
Yeah. This is a very
Yes.
interesting field na
Yes, it is.
marami na ring going into it. And I think it
Yeah.
also helps because one of our big universities in the city are offering those courses,
Yes,
even
yes.
graduate level.
Yes,
So
yes.
we have St. Louis University, we have
Yeah,
UP
UB,
Baguio.
UC,
Oh yeah, even the
UC,
private
oo.
schools apart from St. Louis. So given that, no, it's a very fertile ground for young professionals
Yes,
also.
yes.
Na sana nga sa ating counseling in their fourth or in their senior years in
Yeah,
high
yeah.
school,
Mm-mm.
this is one opportunity that sana ma-open sa kanila.
Ma-open,
No?
yes.
There's a very big need out there. So malaki ang demand for this kind of professions.
Tama po.
Oo. Bago tayo magsara sa
Yeah, o,
topic
diba?
natin.
Ang bilis ng
Oo
oras.
nga eh. Ma'am, may tinatawag din kasing work and life balance
Yes.
in the context of the work
Workplace.
environment. Is it because of the pressure that the employee experiences at work that she cannot achieve this balance, or is it something personal that person cannot detach his thought patterns sa na nakalaging iniisip yung work niya
Mm-mm.
kahit na nasa bahay na.
Mm.
So which one is it? Ano kaya doon?
Actually, I always look at, based sa studies kasi our stress is caused by external factors. 30% of our stress are caused by external factors. Ito yung demand ng work, yung bossy mong boss, yung mga hindi okay na mga workmate, yung
Or
mga
mga
yan.
clients, di ba?
At saka
Oo.
mga demanding na clients. That's the 30%. The 70% actually comes from you.
Oh,
How you
right.
take it.
Yeah,
How you take it. Ikaw ba, break mo na nga, tapos na ang work ng 5, pag uwi mo, ano pa bang iniisip mo? It's your choice. Ano bang iisipin mo? Yung trabaho bang iniwan mo? O yung kung ano yung nasa family mo? So, actually, the 70%, control natin yun. It's how you react to stress.
Okay.
It's how you react to these work demands. Pag sa tingin mo, ang dami mo ng workload, it's your call to communicate it to your boss na I think hindi na siya reasonable, hindi siya kakayanin ng 8 to 5.
Yeah.
Diba?
So you have to give me another day.
Yes, yung ganun.
Oo.
I think, habang kasi hindi natin kino-communicate, ang akala ng boss, kaya niya.
Okay.
Natatapos naman eh.
Sige,
Namimit
bigyan ko
naman.
pa.
Namimit.
Dagdagan ko pa yung work niya.
Diba? Namimit naman ang deadline. So,
Oo,
mukhang walang problem. But if we really communicate, So the 70% actually comes from us. It's how you manage your stress. It's how you deal with these stressors. Yun yung magde-define kung pa-burnout ka na ba or you will be thriving despite kung gaano ka
despite of
chaotic yung
yeah.
workplace mo.
Tama, oo. This is very interesting, kasi all the while we thought that it's the external environment that causes us stress. I mean, that brings us to an unhealthy mental health. But I'm
Yes.
sure not many of us know that.
Yes. And I do
Karamihan
not know
sa
how.
atin ay paano nga ba? How do you make good of that 70% that you have control of? Any advice po?
Unang-una sa lahat, the first key to be mentally healthy is self-awareness. You have to be aware of yourself. Alam mo kung anong strength mo, anong weaknesses mo.
Oo.
Alam mo na nga ang weakness mo, you do not say no.
Oo.
Then you do not improve yourself. So pag alam mo yung weakness mo, ay ako yung taong nahihirapang mag-say no. So siguro I have to change that attitude. So maybe I can start saying no na. I have to also manage my time. So self-awareness is very, very important. Another thing is you have to find positive coping mechanisms. Parang pag dinidiscuss ko kasi ang stress, parang bucket yan. Yung bucket na yan, hindi mo control kung anong pumapasok na stressors.
Okay.
Pero yung bucket mo na yan, dapat may gripo ka. Mas marami kang gripo.
Pag-release.
Para nare-release. Ano yung mga gripo na yun? Yun yung mga positive. Like,
Oh.
you go for exercise, you sleep, you eat healthy, you talk to friends. Kung plantita ka, you find time to...
You talk to your plants.
Yes, you talk to your plants. Parang, yung mga gripong yun, you have to create many para yung stress mo may lalabasan. Karamihan kasi sa iba, wala silang gripo. Tulog lang ang gripo nila. Pagod sa work, pag uwi, tulog.
Oo.
Bukas gigising, gano'n na naman. Syempre, pag yun lang ang gripo mo, saan lalabas yung ibang stressors mo?
Kung mas mabilis ang pagdating ng stressor.
Correct, di ba? So, yun ang very important. You have to take care of your physical health. You talk to your friends. Connect with them. You go for coffee. And if worse comes to worse, you contact a professional. You come to PMHA, you seek your spiritual advisors, mga pastor nyo, pare nyo. You can go talk to them para lang may pag-vent outan kayo. And find yung mga hobbies na nagpapasaya sa'yo.
Yeah. So again, it's so enlightening,
Thank you,
that
ma'am.
knowing that we have actually 70% ability to control something that would stress us.
Yes,
So,
yes.
and I like the gripo concept.
the
Let's be creative in finding positive ways to release our
Yes,
stress.
yes.
That's very interesting. So again, thank you, Miss
Thank you,
Gina.
ma'am.
It
Thank
has
you,
been a
Ma'am
very
Lucy.
interesting discussion. I
Yeah.
think we should have some more of this
Sure.
and target the younger people. Kasi I
Yes.
remember you saying that meron din kayong for the
For the
youth.
youth,
It
yes.
could be something that we can do sometime soon.
Sige po.
Na kasi ang ating audience na gustong i-reach ay it's a broad population. So but kuminsan kasi mga adults, siguro mga nanay at mga tatay na nare-reach natin kasi this usually comes out Saturdays sa Sabado tayo nag-i-air, but even young people siguro within the during the week, probably if we can reach them. Baguio Chronicle would be very much like to be a partner in
Sure. Thank you,
in
ma'am.
addressing the mental health situation in our community.
Yes.
Gusto nating maging instrumento rin na and I think podcasts such as this,
Yes,
conversations with expert like Miss Gina, would really help enlighten our community out there. So again, maraming salamat.
Thank you, Ma'am Lucy, for having me here. Thank you, Baguio Chronicles, for inviting PMHA. Maraming salamat po.
Maraming salamat din po sa inyong mga nakikinig at nanonood dyan na aming mga kababayan. Sana po ay marami kayong napulot na bagong kaalaman ngayong araw na to patungkol sa ating mental health. And again, we would like to solicit comments from you.
Yes.
Sana ho ay may feedback. Ano nga po ba yung iba niyong gustong pag-usapan? Meron pa ho ba tungkol sa mental health na gusto niyong tanungin? I-message nyo lang po kami. No? You just send us, give your comments, and send it to us so we can address it properly. Again, maraming salamat at saka sana patuloy kayong isubaybayan, i-like and follow ang sinasabi nila
Yes. Oh,
sa aming Baguio Chronicle Facebook
Facebook
page.
page.
And again, maraming salamat and good day to all of you.